So as I walked around looking for phi faces, because my eye is kind of phi, she has a pretty phi face. And because she's from California, she's
very
outgoing.
phi.
So she'll be easy on display. So, and she has an experienced face already. So meaning that she's had treatments before. So she's had experience. So, and because of her discipline in her life, even though she's from California, she hasn't had she had a fair amount of sun actually, but not enough to create wrinkles. So she's just barely a quinquagenarian. So she's just turned 50. So quadragenarians are 40 to 50. That's 70% of my practice. I have lots that are in the 50s, 60s. And the 60s are the sextagenarians, and 70s are septuagenarians, and we even have some nonagenarians in our clinics. So she's got genetically a really good face. And the first questions I talked yesterday that I asked my patients is often throws them a little bit is, what are the best things about your face? So what's the best things about your face without having a mirror? What have people told you that's nice?
My eyes.
Your eyes are fantastic. So the color of her eyes are very engaging. So she's probably been told since she was a little girl, you have beautiful eyes. So her eyes are great. And to enhance those, she doesn't have any baggy eyelid tendency, but she's got a tendency for her brows to be a little flat. So that flattening happens with time. Scowl a little bit for me. And because she's had some neuromodulator here, that's altered that a bit. So you'd like to look at her photos in her 20s to see if she actually had a peak to her brow. So if she never had a peak to her brow, then it would be a mistake to create one. But I would suggest she would have had a bit of a peak to her brow at one stage. And so, yeah, just a little bit, just to make it a little perky. So having perky brows, having perky anything is quite good, actually. So having a little perkier brows, and she's had some cheeks injected below here, and she had her lip injected a little bit. And then we start looking at those things we could improve a little bit as well. So what else is nice about your face?
Cheeks.
Your cheeks are fabulous, fantastic. So she's got them accentuated a little bit, and what's nice is whoever's injected her, you inject yourself or you have somebody inject in the rear view mirror of your Mercedes or something? Okay. So I don't know if it shows here, but she's got this form shadow. As we talked, you can't have a shadow without light, and you can't have highlights without a shadow. So if you injected this whole cheek, it would look like a pillow face. So she has this really nice form shadow here, for sure. And we always draw on faces. Both Arthur and I draw on faces. My nurses are really good at it as well. So there's different ways you can do this, but if we draw from the lateral canthus to her tragus and the corner of her mouth like this, and drop that line down a little bit and circle this a bit. And there's a couple of reasons for doing this before we measure her for phi here. So I'll try to stay out of the way a little bit. So lateral canthus down to the corner of her mouth. This is a Czechoslovakian eyebrow pencil you can almost blow off. So if you look at her face now, and you can tell me which side's bigger, fuller, the right side or the left side? The right side. 80% of the population, whether you're right-handed or left-handed, the right side is a little bit fuller. And this is her fuller twin. But she's not a twin. This is her fuller sister. So each side's definitely not a twin. It's a sister. So that's a little thing just to get started a little bit when you start looking at it. What are the other things that are good about your face? So what are the other things good about her face? Her jawline. Her jawline's fantastic. She's got this nice occlusion shadow that we like. She's had a little bit of filler along here, but it's very good. So it's a very youthful shadow. And you like to have that shadow so you get that nice angle here. It's very, very nice here. So can you see that? Yeah, so that's very good. So what are the other things that are nice? Come on. Speak up so I can hear. What did you say out there? Can't hear you guys.
Her nose. They're saying her nose.
Her nose? No. Her nose is not good. Her nose is not good. We already had this discussion, so she's not going to be offended. That's one of the reasons she's up here is because she's got a challenge with the nose. So what is the challenge with her nose? We'll measure it, and to see the measurements are all right. But what's this? Okay, suck through your nose hard. She has collapsed nasal valves. Her nose is not good. Whoever said that, leave the room. I don't mean that quite literally. But that's fixable. That's very fixable without surgery. In fact, we might do that today, Arthur. We'll see if we can do that a little bit. Okay, so you can almost guarantee, if you're a little bit of a Sherlock Holmes, she snores at night. Do you snore at night? Mm-hmm. She snores at night. So that's almost a guarantee because of this valve is collapsed. So you breathe through your nose. Mm-hmm. So breathe hard. Much better on the right side, right? Mm-hmm. Not trying to talk you into it. And then if you sort of look, and so what are the features that we would like to see better? What are the features you'd like to see better besides the nose?
A little bit more.
Yeah, a little perkier brow. Mm-hmm. Okay.
Mm-hmm. I don't know.
Okay. Does she have masseters or not? Does she have enlarged masseters? How would you know? You have to feel them. Because some of the most powerful masseters that are destroying teeth, you can hardly see. It's not related to size. Some of the biggest masseters we see have no symptoms at all. They just enlarge from clenching and chewing and grinding, but not enough. They just stimulate muscle, but they don't stimulate it enough to create the changes. So if we feel her masseter clench, she's got great. And most of the masseter is the deep masseter in her case, because that deep masseter is actually stronger than the superficial, but it's smaller, and it creates that change there. So you're grinding your teeth a little bit? I think so. Yeah, and she's got, open your mouth a little bit and see her teeth. See the bottom open up a little bit? Not enough. She's not doing it enough to grind them that much, but a little bit. So the other tip off is she's hiding a little bit. Okay, clench your teeth. So she has temporalis muscle, and I can almost guarantee that size and hardness of her temporalis muscle, she's got headaches. Do you have headaches? Mm-hmm. Yeah, she has headaches. I'm not trying to put words in her mouth, but she'll have headaches from that. So she's more of a clencher, not so much of a grinder. And clenchers are a little bit stressful, but they're not usually gum chewers. So instead of getting ulcers, instead of hitting someone over the head or punching in the mouth, she's clenching her teeth. So she's a little bit of a clencher. So those are just the little things you can pick up on a little bit. And now if you start looking at things you'd like to see better, what are some of the other things you'd like to see? It's hard from where you guys are to see it all. So what's happening here? What's happening to the pregal sulcus? It's making her look like her chin's a little pointy because she's losing volume in the pregal sulcus and the lateral commissure and the marionette. Marionette's not a line. I'd suggest you erase that from your vocabulary. It's a marionette zone. So the lateral commissure and the marionette zone and the pregal sulcus make up this little zone here, and we'll want to improve that. So that's kind of what I would look at. And then we'd say to the patient, talk about faces are all about genetics. She already knows she's got a great face, but even the best faces we don't keep forever. So she's at our clinic here today because she would like to look better. Even though she looks 40 and she's 50, she'd like to look better. So those things we would say, okay, what are the things we can do to look better? So Arthur, why don't you measure, start, and then I can measure part of it as well there. So we would come out and say, okay, let's just measure this. And sometimes patients that have, she's obviously got good self-confidence, good self-esteem, good self-awareness just by her karma that she's got that I can feel, is patients that don't have that are yet PHI, often it's a great image enhancer to show them mathematically that she's got good PHI. So what I'm going to do...
We're going to measure her, but I want to ask a question to the audience.
Let me just take this off a little bit while you're asking that question.
Sure.
A little bit. I'll just do it gentle so it doesn't take me.
What are the aesthetic danger zones in her situation, in Kara's situation? I don't mean as far as causing any type of skin problem or any type of visual problem, but I'm talking about aesthetic danger zones in things that you're going to struggle to treat and you do not want to draw attention to. That's what I look at as well. Okay? Found this out the hard way. Looking at the proportion of her face. Can we come in on her face, please, just a little bit? That's perfect. What is the aesthetic danger zone in her? What's that? Her cheeks. Okay, you think it's her cheeks because we see light reflexes anterior and low. We would like to have the light reflex up here. Look how her face looks a little bit narrower, more oval, because that's what we're seeking. We're looking to put her into oval. Okay, that's fine, but that's not the one that I'm thinking of. What else? What? Prejowl sulcus we talked about, but are you going to be able to treat that? Yes. Are you going to be able to treat the cheek? Yes. What should you not treat? That's my aesthetic danger zone. What should you not treat on this patient? Or if she comes in to see you, Cara? I'm going to start to focus in, guys. You tell me where I'm going to stop. Tell me when to stop. Absolutely. Upper lip. Why? It's long. Look at her ergotrid from the distance, because you've had surgery on your nose? Okay, this is a natural nose that you have? Beautiful. Her nose from the base of the columella down to the lip is long. She has a long upper lip. If you go ahead, my aesthetic danger zone on her is and she's smartly not augmented her upper lip. If you give her a big set of lips that are over here in something that you cannot correct, which is the length of the upper lip, people are not going to notice her lips. You're going to be drawing attention to a feature that you cannot correct, and people won't comment on, when did your upper lip get so long? You're drawing attention to it. So I would not give her very full lips. I would proportion her, but that's it.
Once you improve her nasal valves, then your eye goes off the longer upper lip. And once you lift the base of the piriform fossa,
right,
and lift that up a bit, because as Arthur was talking yesterday, that whole base, the root of the nose is retruded. So as you project it a little bit and lift the nasal valves up, the lobules up, and expand them just a tiny bit, your eye does not see the upper lip.
Good.
Right, Arthur?
Yeah, it helps. There's no question that it helps. But be careful in augmenting lips on patients who have long upper lips. Okay. So she comes in to see me the first time. She says to me, tries to hypnotize me and says, fill my lines, whatever the story is. And I say, okay, I'd love to do that, but I want to measure your face. I think that you have beautiful proportion to your face. And I give her the 2-minute story about the fact that I'm going to try to measure and see how she measures up with proportion while her friend is sitting on the extra chair, right? Okay, so the first question I ask her, do you wear your hair up or down? Down. Why does she wear her hair down, folks? What do you think about the height of her forehead? Slightly high. Slightly. We measure the distance. So as Kent was telling you yesterday, the first distance that you measure with the short end of the calipers is the distance between the eyes. So you go from medial canthus to medial canthus. I tell patients, make it very simple for them. Tell them as often as you see this distance and this distance on their face tells you how beautiful they are, how closely proportioned they are, how ideal proportioned their face is. So we measure this up like that. And if we measure her forehead, we see that her forehead height is slightly high. Women instinctively know this and will wear their hair down to try to cover it or match it. The same thing for a low forehead. So she's looking in the mirror and she's now in the game. She understands. So then we measure. This is how I do it. Then I say, well, let's take a look at your eyebrows. Her eyebrow length is pretty good. Okay, it's about 1.618. But her peak should be at 1. So I tell her what we can do is we can elevate the eyebrow just there. Look at the difference that this makes in her look. Which side of the face looks more alert? Which side of the face looks more engaging? When we meet people for the first time, where do we look at them? In their eyes. This is evolution. We have to understand the eyes are the window of the soul. Are they friend or foe? You look in the eyes. If they are engaging, you engage. If they're not, you back off. So that tells me that I will put the apex here. Not here, not there, but here is where I'll try to design the apex for her. Okay? And then we take a look and we say that the distance between the eyebrows, the distance between the eyes, the distance at the base of the nose, the fullness of the bottom of the lip, and the chin should be all around that distance. They should be 2 straight lines that are drawn down like that. And the patient's watching this. Then you can measure if you wanted nasal length. What do you think about her nasal length? Is it short? What we do is we take the root of the nose, which is a line drawn between at the eyelashes. So you ask her to look straight ahead. You get the eyelash distance. We can mark that out, actually, Kent, if you have a little pencil. Why don't you mark at her lash line? And we measure the length of her nose, which is slightly short. Okay? From this lash line marking for nose is key. This is where the nasal frontal angle exists, which should be around what in females? Anybody want to take a guess? No, it's not 1.618. It's in terms of degrees. What do you think is the natural degree? Do you have your show them on the caliper? Mm-hmm. On your caliper over here. Or you have your, there you go.
Should ask them what it should be.
The radix of the nose. The radix of the nose is where the nose begins off the face. If it begins up too high, it gives you a masculine look. If it begins too low, it gives you a short nose look. So you want it to start really where it's pretty much ideal. Have a patient, a female, stare straight ahead. Where their lash line is, you draw a line across. That is where the nose should normally begin in a female. In a male, it's at the tarsal fold. It's a little bit higher.
Yeah. And you could, I use the tarsal fold. Depends if they got eyelashes or not. Sometimes the eyelashes get confusing because they're too long and they're blinking away. So the eyelash fold is a good enough one to use. Hers is 100 degrees.
100. And what should it be? Anybody?
Yeah. And also her nasolabial angle is a little bit, we could measure that too while we're measuring angles here. What's her nasolabial angle at, this one here? What does it look like? In Caucasian women, it should be 95 to 110 degrees. Anybody volunteer a guess? My nurses are almost bang on every time. Any guess?
135 is for the frontal angle, but you got that okay. You got this. But this over here is usually around 90 degrees in men. We like it a little straighter in men. It's 95 to 110 in females. Okay, just to get an idea. Sometimes don't be fooled by the columella, the way that it meets the lip. What we're looking at is really nasolabial angle. Sometimes it's actually looking at the line of the nostril and seeing how that interacts with the upper lip.
Sometimes what you're measuring is the columella angle, but in her case, it's the nasolabial angle is 100 degrees. This is pretty well bang on here for her.
Right.
So this is a obtuse angle type of protractor. It's not a caliper.
Okay. So we go through that.
Now, while we're on this nose, it's a little bit short. How would you make it a little bit longer?
Anybody want to volunteer? You can't. You can't lengthen a nose.
You can lengthen a nose, and you can also shorten it.
You're probably right. You probably can't physically lengthen a nose, but you can give the illusion of a longer nose.
But you give the illusion of a longer nose.
Right.
By where you put the filler in the radix. If you put the filler that's got a little G1 prime a little bit and just give that radix a little bit of a lift where it joins onto the rhinion here, where it joins onto the bone, then it gives you the illusion of having a little bit of a longer nose.
So that's number one. Can you shorten a nose? Yes. With what? Filler? You can probably turn a tip up slightly with filler, but if you want to shorten a nose, go with toxin. And we'll talk about that when we get to a patient, because if you go ahead and you treat the transverse portion of the nasalis muscle over here, and you treat the depressor septae muscle over here, the muscle that's left that's active in the nose is the other lobe of the transverse nasalis, which is called the dilator nares muscle, which is an elevator of the tip, and you will elevate the tip and actually shorten the nose.
Yes.
Okay, that'll give you about 2 or 3 millimeters of shortening, which is sometimes all that you need. But okay, let's go back.
You can also add a little HA filler just below the radix a little bit as well. Now wrinkle up your nose like a bunny rabbit. Okay, no, she doesn't have much nasalis going on there.
Okay, so Patient comes in, I measure over here, I show them their forehead, I show them their eyebrow, okay? I show them the distance as I'm going down over here and saying, wow, look how great you're doing. And then I'll go, and this is the one that people get hung up on, which is why I have my calipers designed like this, is to do facial width. And facial width is going with the distance between the eyes over here. That's why my caliper is designed like this, is that you can rest it over there and you drop this line down vertical. So, to be honest with you, what do you think about her facial width? Does she have room to be able to add in a little bit of product laterally like that? And the answer to me is yes. This, I think, is going to be such a more becoming look to her than having the volume anteriorly over here, okay? This is what we like to do in Caucasians, is we like to do that. Asians have that by genetics. They have strong muscles over there. So she'd be a great case if we were to inject her later to show how I could narrow her face by adding volume. The exact opposite of what you think. And I go through and I say, well, look, that's why you have a little bit of folding here because a little setback over here. This would be an outstanding place to inject, as we've done in the past. Wasn't with her, but it was somebody else, I believe. Wasn't with you, was it? No, because you're very similar to the one we injected last time. Kent sort of has the eye for that. To be able to support her nostrils and everything. And I go through those measurements. What other measurements do you want to show a patient? Remember that the chin, as the marionette, is a zone. So when you have a chin zone, it's not just anterior projection. It's anterior projection, width, and what's the third measurement? Height. What do you think about her chin height? So this is where I use my caliper again. I measure over here like this, always measuring off the base. Okay, you can get very detailed if you want, but what you want to do is just show the patient basic things that you'd like them to understand, which is facial width, facial height, eyebrow position, length of nose. We'll talk about the lips in a minute. Okay. We turn her on profile. Chin projection. Chin projection. Okay, if you look at Steiner's line, as we call it, Steiner's line is from the anterior projection of the upper lip, anterior projection of the lower lip. There's her chin sitting behind it. In a female, it should be 1 millimeter behind or slightly touching. In a male, it has to be touching or anterior to it. Would I inject her chin? The answer is yes. I would give her more chin projection to go forward. Okay? As far as height, in a female, normally the height of the lower face is when you measure this for the intercanthal distance, you measure from the upper lip to the chin, and she's bang on. So she has good height from here to here, but lacks a little bit of projection. If she had short height, my injection in the chin would be down in this direction to project. But now all I have to do is project it slightly forward to give her more balance like that. Okay? Chin width, we said, should be about the distance between the eyes. Think in a female of drawing a line from the, and I discuss eyebrows with my patients, which my wife thinks I'm crazy about, especially when you see my eyebrows. But in a situation, I think there's a family living in mine. But if you go from the medial brow down through the medial canthus to the base of the nose, through the bulk of the lower lip volume to the chin, that's feminine. If you want to masculinize her, you make her chin wider. In a male, it's from the inside of the iris, the line coming down to the outside of the mouth to the chin. Okay? So we do those, and very often, 3 out of 4 patients will say to me, well, can you do, and I say, okay, now I'll go and do the thing that you asked me for. And they'll say, well, can't you do a little more proportion for me in the chin or the cheek? And that's where you open up the patient's now understanding it's a full face deal. It's not just chasing a line.
Now,
go ahead.
These calipers are the same. The ones you have to have in your box are these, but it's exactly the same. PHI is PHI.
Agreed.
It's just, this is so you can put it in your pocket, and we'll just walk through very quickly with the camera so you can see. And I always tell patients, it looks like I'm going to stick you, but I'm not. So that same, we'll just do this very quickly, that intercanthal distance. And then you can lock down this little nut so that it keeps it tight there. And so that distance should be, we'll get that right on here.
It's usually somewhere between about 27 millimeters and 31, 32 millimeters.
Of course, that distance shouldn't change from puberty to 100. That's one of the few distances we keep hammering on that stays the same for that patient. The next patient is going to be a little bit different. So immediately you know she's got an eye for her brows because the actual intracanthal distance is bang on with her eyebrows. She's got, if you notice, one side's about 2 millimeters off. This side of her brow, the head of the brow, is a little more medial than the right one. And they should ideally, you can use the other end of your calipers to show patients that the brow, the head of the brow should be lined up with the inner canthus and the owl of the nose here. But her, and I wouldn't change this, it's too subtle. But then the other side of this, the PHI side, as Arthur's already demonstrated, is the length of her eyebrow. And she's kind of cheating a little bit with some little hairs there because this should be, right?
Yes.
This should be lined up with the lateral canthus with the
base of the
corner of her nose. Mm-hmm. And it's just a little bit short. And that's the reason there's eyebrow pencils. And she wouldn't do well with eyebrow tattooing. She just got the wrong genetics for that here. It just would not look great. So that length of the brow we talked about, she already intuitively knows that her hairstyle, and I usually measure that mid-pupil is where that length should be. And it's pretty right on.
It's pretty close.
And I should have been a hairstylist, actually, Arthur. There's all kinds of styles.
You have the look,
now
Kent, for a hairstylist. No question about it.
I would right in well with eyebrows.
I would trust you implicitly with the bowl and the shaving and the whole
And
bit.
while I'm still staying with the PHI, that apex of the cheek should be 45-degree angle out from the lateral canthus. And her apex is beautiful here. But she needs a little bit, I agree with Arthur, she needs a little light reflection, just a little bit lateral, just a little higher on her apex would make her look a little more youthful. And then that length of the brow should be the width of her lips, which is bang on, except she's starting to recede the corner of her mouth. She's starting to look like a quinquagenarian. That's about the only place she looks like that. And the reason I use this measurement for the chin is even though the apex of the mentalis is the intracanthal distance, it helps us determine where that little hollowing is. It helps patients understand that's where you need to lift this whole little zone up. So that helps you with that. And then the width of her nose should be the intracanthal distance. And you can see it's okay, but it just helps to show the patient that's what's happening here with not only her collapsed nasal valve, but she has this retruded piriform fossa, which is kind of a no-fly zone. But there are ways you can fly there. So we'll show you today a little bit how to be safer in that little zone. And then the other thing that I noticed when she's breathing in hard through your nose, she's also got a collapsed internal valve, Arthur. Mm-hmm. So there's ways to lift that up as well to improve it. And we can talk about that when we do a little bit of a filler for her. And those are basically the measurements. So you can use the other side of your caliper with a straight line as well to help you with little guidelines there. But those are some of the guidelines. And I wouldn't you can do facial width and you can do all of that, but it often confuses patients in my experience. So it's better to keep your measurements fairly simple. Brow, nose, cheek apex, peak of the brow, the lips, the chin. Even if you start with those basics, it'll put you ahead of the Yoho down the block that doesn't even have a ruler. So that's what I would suggest.
Okay. You can try this on people next to you. I'll give you, for those of you who want to have a little more advanced things that you can look at or things that you can sort of envision. When we talk about the upper third of the face, we talk about the feature of the upper third, which is the eyebrow. Kent and I have just published a chapter in a textbook on eyebrow contouring or shaping. It's not lifting so much as it is contouring an eyebrow, right?
Okay, thanks, Kara. Very good. Thanks, Kara.
Thank you. What you can do is you should look always where the eyebrow begins, the medial head. The medial head of the eyebrow should line up in a female at the intercanthal distance, okay? It should be, that intercanthal distance should be above the medial canthus. So I tell patients if they're unibrow, you got to pluck. If I tell them that they're plucking too much because the eyebrows look too splayed. Now, we know that when we give toxin into the glabella that you can splay the eyebrows. You'll see patients that will come back sometimes, their eyebrows are starting at their pupils. Look at Nicole Kidman in Moulin Rouge. Her eyebrows are way out. So using toxin here isn't just for eradicating lines. It's for creating beauty. And a beautiful eyebrow starts at the medial canthus. Check your patient before you give them toxin. This is simple. I mean, this is injection of toxin for the glabella is like where we all began. But there's little intricacies that you can do that make the patient look better so that their friends will say, I don't get that result with my doctor, and they'll come and see you. So you check to see how glabrous or how much distensible the skin is of the brow. Spread it. If you can spread the eyebrows before you inject, because the skin isn't resilient over there, I guarantee you that if you put toxin in over here, because of the way that the corrugator is a medial puller of the eyebrow, you're going to lose that tethering effect and the eyebrows are going to splay. Have you seen this in any of your patients where they come back or you're not looking for it? You should. So you can gauge what you want to do with the eyebrows by the location of your toxin height and width. How do you do it? If I have a patient that has a very distensible glabella, I always inject frontalis. Frontalis is the reason the eyebrows splay, because the frontalis muscle is angulated like that. So you put in 2 units on the upper part of the frontalis just to create the balance so that the eyebrows don't splay. You'll see your patients will remain with their eyebrows at the medial canthus. The distance or height of the medial canthus is the reverse of phi. If you use... Hey there.
Bina.
How are you, Bina?
Great.
If you use the big end of your caliper and measure between the eyes like this, okay, then the height of where the eyebrows should be, let me bring this down, should be from medial canthus to brow. Look how perfect it is on her.
She's pretty fine.
Is 0.618. It's the opposite. You can adjust that corrugator belly injection to adjust the height of the medial brow. You know that sometimes if you're a little too high, the brow comes down. The patient says, I have a heavy look over here. You can do the opposite. You can actually elevate the brow. Instead of placing your injection for your toxin where you normally would place it, go down 1 or 2 millimeters a little inferior, stay medial to catch the depressor supercilii, and stay deep. The eyebrow will float up medially. If the eyebrow is too high, you can take your injection here and go 1 or 2 millimeters higher than you normally would, and not as deep, catching some of the fibers of frontalis and drive the eyebrow down. Careful.
Yeah.
Because you don't want to cause a heavy-lidded look, so you have to look doing for that in the elderly patient or the more mature patient. Make sure that they have enough hollowing medially to be able to gather that extra skin. Otherwise, they're going to have like a little pleat or a fold there. But these are things that you can do. Go ahead, Ken.
Clench. Okay, relax it. So Bina is, she's one of the few people I've ever met that's pure blood. I just met her today. I'm a Heinz. I'm a little mixed a little bit here, but she's pure Indian, South Indian, not East Indian, South Indian.
From where?
Kerala.
Yeah. So, but she obviously should get up every morning and thank her parents for her phase 2, which I hope you do, because your face is amazing. So she is pretty FI, but she has a few things that we could look at as well. So again, we could go through this exercise a bit of looking at things that are positive. And we met here a few minutes ago, so we haven't bonded yet, so we'll have to bond here a little bit. So what are the best things about your face that people say? Yeah, her lips are fantastic. But she doesn't have the Caucasian balance that sometimes you're looking for. She has a balance that we need to address, because we're seeing more and more patients with skin of color of all mixed groups. She happens to be a pureblood, but we're seeing mixed ethnicities now, and we have to be aware of what their genetics is and not try to create lips that somebody else would like or have. Create her lips kind of thing if she had lip deflation and loss loss of their shape. So what are the other things that are good? Eyes are fantastic. She's got beautiful, beautiful eyes. I mean, not only the color, but the shape and size and position is very striking. So what do you look at when you look at people? Eyes and the mouth, right? So we've got two things that are just striking. Sometimes you can ignore everything else that might be negative. So what's the other things that are good? We could go on and on here.
Yeah, we could. Spend an hour talking about it.
What's that?
My glowing personality.
Your glowing personality.
Glowing personality, yeah.
You're
well,
right.
That's a given. So obviously her smile that's what attracted me right initially was her little catchy smile. So her cheeks are fantastic. Her eyebrows are exceptionally good. Usually eyebrows together are sort of distant cousins, but hers are almost twinned. So they're very good. And cheeks are good. Jaw angle's good. What things do you all see out there that are nice?
Skin tone, texture, and color.
Yeah.
That is so important.
That sort of the Magnificent Seven thing we've talked about quite a bit.
Absolutely.
Okay?
Right.
So how about her masseters? Does she have large masseters? Yes, she has large masseters. So you may make sure you get out from behind your desk and go over and actually feel this patient and touch her and get permission to do that and see. And you could feel her masseters clench. Yeah, she could crack walnuts here. So and clench her teeth here. Yeah, did you get headaches?
Occasionally. Yeah,
occasionally. And she would get it from her temporalis would be one of because she's got large temporalis. Let's see her teeth. Let's see her teeth. Open up a little bit. So you a grinder or a clencher?
Clencher.
Yeah, she's a clencher. So with grinders, usually you have quite a bit of asymmetry with them, and you obviously have some issues with the joint as well. Let's see, open your mouth up. Because we're going to talk about this a little bit later with the TMJ. Okay, open up and close, open and close. Yeah, and this feels fantastic. You ever get any clicking in here?
Mm-mm.
So she wouldn't get clicking because that joint has its own capsule and it has its own disc, and that capsule has its own nerve supply, and as it gets irritated, it gets thick, and hers is beautiful. So you want to feel that as we're talking about introducing you to being more observant. So if you measure her, if we say, okay, let's see, what things would you like to see better?
A little more volume in the cheek, maybe.
A little more volume in her cheeks. Now she's pretty petite. What are you, 5'1"? 5. Okay.
But thank you.
So she's petite. So if we look at, and usually I have patients have a mirror. So we talk about genetics, as we talked yesterday a little bit. Faces are all about genetics, and genetics are all about biology. Biology is all about physiology. Physiology is all about physics, and physics is all about mathematics. So when you get great end results from syringe therapy, from Botox, fillers, from Kybella, Belkyra, then that's the end result is a result of good mathematics. So that just happens to be the way it is. And if you're going to measure all this thing, then you got to start out with basic measurements. So with the caliper you've got, then you want to do that intracanthal distance again is that basic measurement. Whether she's, no matter what her skin color is, and we'll try to keep, I won't stick you here, Brina. So that distance between the eyes stays pretty constant here, that intracanthal distance there. Okay, and that distance should be the distance between her brows here, which is bang on. So she plucks her brows a little bit, and her brain tells her already, now do you shape your brows yourself or do you have them shaped? They're shredded, yeah. So she has that done professionally. So whoever's doing that's got a really good eye. But that distance is perfect, and that should be the width of her nose and the maximum volume of the lower lip. Not the whole lower lip, but the maximum volume. And then the other side of this is the thigh part. That should be the length of her brow from the head of the brow. And she's got a little laxity of the hair here. It's not a big deal, but that's just to complete the brow, you'd have a little hair on this tail that would line up with the inner canthus with the ala of the nose. And then that length of the brow should be the height of the forehead at mid-pupil. Okay? So is her forehead high or low? It's a little bit low. So how do you wear your hair normally? Yeah, back. So her brain tells her that it looks better to have that hair off a little bit. And some people will even do hairstyles to clip this a bit. You've clipped that a little bit to keep the hair shorter there, right?
No.
Don't you? Okay.
Permanent baby hair.
Yeah. All right. But it's just some people will do little techniques to remove a little bit of that hair because their brain intuitively tells them that the height of the forehead is to be better balanced. It needs to be a little bit longer, but it's subtle. Okay? And then and then the length of the brow should be the length of the nose from the eyelashes, or if you open your eyes a little bit, look straight out like that a little bit. Hers, I would use the supratarsal fold, and her nose is a little bit short. It's not a big issue, but there's ways you can adjust that a little bit. And the apex of the cheek should be the length of the brow from the inner canthus, and her submalar part here, the apex is a little bit shallow there, so she already knows intuitively that part of the cheek could be reflated a bit and contoured. Not inflated, but reflated. She has some nice shadowing back here, which I'd leave, but she does have a bit of an apex that you could lift up a little bit. Then the chin, you could do the inner canthus, or I like to use the brow measurements there, the PHI, to show you a little bit. And she's got a little bit of a square chin. So if you look, her chin is a little bit square. So to feminize a chin, you give nice soft curves and feminine features, which is more of a softer chin. So in men, you want to have masculine structure and strength, which is a square chin. So she has a little bit of a masculine chin. So you just agree, Arthur?
Right.
You just want to just smooth that out just a tiny bit. That's about the only masculine thing she's got on her body here, is that chin a little bit. So, anything else, Arthur? Do you want to measure? Oh, I'm going to have Arthur measure her lips here. Talk about her lips here.
So we talked about the fact that most Caucasians, what you're looking for is a 1 to 1.618 height ratio between the upper and lower lip. And people of color, people who have any type of color to their skin, then you can go with a 1-to-1 ratio. Asians, Afro-Americans, Latinos, you can do that, okay? Indians as well, okay? South Indian, all right. So what we do over here is the following. If you really want to get an idea of PHI measurements of the lip, if we take a look at the intercanthal distance, we measure the width of the mouth. She's doing very nicely, okay? She's doing very, very nicely over here. Upper lip should show vermilion from commissure to commissure. You want to see red all the way along. Most people look at lips to enhance lips by doing this. I look very often at lips to enhance lips by doing this.
Right.
Okay?
Yeah.
She has beautiful vermilion show from commissure to commissure. Lower lip typically tapers with the vermilion towards the corner. So even though a patient like this has a nice balance to her lip, would I inject her lower lip? I would. I would inject her lower lip and give her just a little more volume in the middle part of it, and that will give her more of the flow to the lip. If you measure from the base of the nose, okay? Kent can use his little calipers for this. If you measure from the base of the nose to the top of the cupids, okay? That will give you where your cupids, or the philtral columns, I should say, should be. The philtral columns are just inside the cupid's bow. So from here to here, for as far as 5 proportion, gives you this, okay? And that distance is also the height of the lower lip, in her case. Look at this, okay? So this is 1, this is 0.618, and this is 0.618 relative to the lip. Even in the lip itself, if you take a look widthwise, this is why she has such beautiful lips. Look at the PHI on her over here.
Yeah, it's perfect.
Yeah, she's really, really good. So these little tricks are things that you can use. They'll get inside your head. You're not going to have to sit there and measure everything on every patient, but they're going to get inside your head. The upper lip should be 2 to 3 millimeters ahead of the lower lip. Okay, can we come in tight on her? A little tighter. There we go. So the upper lip should project by 2 to 3 millimeters more than the lower lip. Okay? Lower lip should be fuller.
Show them the chin while you're there. Show them the chin while you're there.
For sure. So we'll turn her over here. What do you think about the position? You can turn your body just a little bit so we don't wrench your neck off. What do you think about the position of her chin? What do you think, guys? Slightly back, huh? Slightly back. Okay? Okay, there's a gap there. Slightly back. And I got to tell you something. And I also think that she's a little short. Slightly short.
Yeah, she is.
So let's take a look at that. If we take a look at this distance over here, and we measure from the top down, she is slightly short. See that? There's a gap down over here. Okay? So what would my chin injection be? Yep. My chin injection would be to narrow her chin at the same time of giving her more vertical height. So my chin injection is going to try to do this, and it's going to be down at an angle like that.
And projection a little bit.
Right. So it's going to give her projection and height at the same time. What's that going to help with her? It's going to ovalize her face. I would treat masseters as Kent would probably do over here.
For sure.
I would give her some injection into her chin to give her height and a little more length over here, a little bit of the bottom lip, and I'll inject the apex of her cheek to give her the V line. She's going to look narrower and a little less square. I'm trying to ovalize her just a little bit more. That's what the masseter injection here and injection here is going to do.
So with ovalizing, what you're trying to do, with ovalizing by adding product, you're adding not only HA filler, in this case, but also adding neuromodulator. So that chemosculpting kind of thing combined with your filler will make her look more oval, just subtly. Gives her that look. And I bet it would look more like she did when she was 30, kind of thing. Give her that, just restore that ovalness that's kind of gone a little bit. But basically, most things about her face are fantastic.
They're beautiful. Injection into the piriform, onto the piriform bone over here, is going to elevate the tip of the nose and narrow her down just slightly like that. I like that better than that.
Yeah.
Okay? I think you're nodding your head that you'd love that too, right?
Yeah.
Okay. So those are little injection things that you can do. It's where a little difference in anatomy
makes a big difference in appearance. Now do your bunny nose there. Do a bunny nose. Wrinkle up your nose like that.
She's
like a bunny rabbit. You can't do it. And try to flare your nostril there. There you go. You could also, with neuromodulator,
take away
stop
the flare.
that flare a little bit.
Yeah, soften the flare, for sure.
She has a tendency when she smiles to flare her nose there.
When we do the assessment of the patient in our session, that's I think this afternoon, I'll show you how I assess patients with respect to movement, because I want you to give me a really big smile, okay? Atta girl, come on. Okay? Is she pulling more with the left side of her face than the right? Do you see that? You can see the molars on the back left, but on the right? Okay. You can see how she's creasing the fold here more. Zygomaticus major and risorius are pulling a little harder on her left side. Do you guys get that impression? Yes? Okay. We can symmetrize her smile. Trust me. To try to hit that risorius with toxin is really difficult, and it's a very sensitive muscle to toxin. If you use more than one unit, you're going to get into trouble because she won't pull her mouth out at all. It's a very thin muscle. But why not bolster the skin that's resisting that pull and keep and narrow her smile down? It's not a question of putting volume into the lower face. It's a question of putting in structure.
Yeah, okay? Strut work.
Right?
Yeah.
Sure. The chin crease meaning your labiomental crease over here? Yes. Where it lies as far as height goes? No. None that I know of as far as PHI rules. I haven't really looked at that or anything at all.
Not really.
But I'm sorry? Or the angle of it like this or like that you're talking about?
We used to measure that, but it doesn't help you much, so we kind of gave up measuring that angle.
When you see a very deep crease, okay, if you have a very deep crease over here, what's your treatment going to be?
If you inject it, you need at least a
Yes, it's an abyss because you're going down onto the bone over here. And if you go down onto the bone in this area, which is one of the safer areas to inject, right, you're going to use a ton of product because the mandible is curved that way. I don't do it that way. I can do it down on bone over here if I'm trying to block movement of the lower lip or to give it support because it's hanging, but that's not what my goal is over here. There's only two places to inject over here. I'll go through that when we do the next session. Either on bone or in skin. Do not inject under the skin over here. The inferior labial artery very often hangs down like a hammock in our anatomy dissections, and it's sitting not in the actual lip, but right behind the labial mental crease. We have so many pictures to show this. Another article that's being written, okay? That labial, inferior labial artery can be right under here. In one of the 98 cases of reported blindness, it was from a chin injection. And I'm sure that that chin injection was for labial mental crease with an injection that was under the skin. So my goal over here is to inject intradermal with a product that has significant G' or stiffness to be able to, very similar to what we do with the internal nasal valve, is to thicken the skin so it doesn't crack in there. But I think you're wasting too much product if you go down onto bone over there.